Have you ever heard of people doing strange things in their sleep, like cooking a meal, going for a walk, or even driving a car? This bizarre phenomenon is known as sleepwalking. Today we're exploring the quirky world of sleepwalking, diving into its causes, symptoms, and some truly extraordinary cases. Stick around until the end to hear about one of the most astonishing sleepwalking stories ever recorded. And before we dive in, don't forget to hit that subscribe button and ring the bell for more weird science content. Sleepwalking, or somnambulism, is a sleep disorder that occurs during the deep stages of non-REM sleep. It involves complex behaviors ranging from simply sitting up in bed to more elaborate activities like walking around, eating, or even driving. Sleepwalking is more common in children, but it can also affect adults. Although the exact cause of sleepwalking is not entirely understood, several factors contribute to this fascinating phenomenon. One of the primary causes of sleepwalking is genetics. Studies have shown that if one or both parents have a history of sleepwalking, their children are more likely to sleepwalk. This genetic predisposition suggests that there may be a hereditary component to the disorder. Additionally, sleepwalking can be triggered by certain environmental and physiological factors. Before we dive deeper into these factors, make sure to hit that subscribe button and ring the bell so you never miss out on our weird science adventures. Sleep deprivation is one of the most common triggers of sleepwalking. When we don't get enough sleep, our brain's sleep-wake cycle can become disrupted, leading to episodes of sleepwalking. Stress and anxiety are also significant contributors. When we're stressed, our bodies produce more of the hormone cortisol, which can interfere with our sleep patterns and increase the likelihood of sleepwalking. Another factor is the consumption of alcohol or certain medications, which can affect the brain's sleep regulation and trigger sleepwalking episodes. Additionally, medical conditions such as fever, asthma, and restless leg syndrome can also increase the risk of sleepwalking. So, what happens during a sleepwalking episode? Typically, sleepwalkers exhibit a range of behaviors, from simple actions like sitting up or walking around the room to more complex activities like leaving the house or even driving a car. During these episodes, sleepwalkers often have their eyes open and may appear awake, but they are not conscious of their actions. They usually have no memory of the event upon waking up. Now let's talk about some of the most fascinating and extreme cases of sleepwalking. One of the most famous cases involves a man named Kenneth Parks from Toronto, Canada. In 1987, Parks drove 14 miles to his in-laws' house, broke in and attacked them all while asleep. He later drove to the police station and confessed, still unaware of what he had done. During his trial, experts testified that Parks was sleepwalking during the incident. Remarkably, he was acquitted of all charges due to his sleepwalking condition. Another intriguing case is that of a woman named Lee Hadwin, who is known as the sleepwalking artist. Hadwin creates detailed and intricate drawings while asleep, with no recollection of his artistic endeavors upon waking. Despite having no artistic training or interest while awake, his sleep-induced artworks have garnered significant attention and acclaim. Sleepwalking is not just limited to humans. Animals can also exhibit sleepwalking behaviors. There have been reports of dogs walking or running while asleep, sometimes even crashing into walls or furniture. This phenomenon further highlights the complex and mysterious nature of sleepwalking. Let's delve into the symptoms and diagnosis of sleepwalking. Common symptoms include sitting up in bed, walking around, performing routine activities, and exhibiting confused or disoriented behavior. In some cases, sleepwalkers may engage in more dangerous activities like leaving the house or driving. Because sleepwalkers are not aware of their actions, these episodes can pose significant risks to their safety and the safety of others. Diagnosing sleepwalking typically involves a thorough evaluation of the patient's medical history, sleep patterns, and any potential triggers. In some cases, a sleep study or polysomnography may be conducted to monitor brain activity, heart rate, and other physiological factors during sleep. This can help identify any underlying sleep disorders or conditions contributing to sleepwalking. Treatment for sleepwalking often focuses on addressing the underlying causes and minimizing potential triggers. For instance, establishing a consistent sleep schedule, managing stress, and creating a safe sleep environment can help reduce the frequency of sleepwalking episodes. In some cases, medications like sedatives or antidepressants may be prescribed to help regulate sleep patterns. And now for the grand reveal. One of the most astonishing sleepwalking stories ever recorded involves a young girl named Rachel Ward. In 2010, Rachel, who was just 15 years old, climbed a 130-foot crane while asleep. Miraculously, she was found safely asleep on the crane's narrow beam and was rescued without any injuries. This incredible case demonstrates the extraordinary and sometimes dangerous feats that sleepwalkers can unknowingly accomplish. If you enjoyed this deep dive into the quirky world of sleepwalking, give this video a thumbs up, share it with your friends, and leave a comment below with your thoughts or any sleepwalking stories you have. And don't forget to subscribe and hit that bell icon so you never miss out on our next weird science adventure. Until next time, stay curious.